Good afternoon, ladies and gentlemen. Welcome to this new episode of Medcast. We are so pleased to have Mr. Yousef AlSaleh, who is specialized in physical medicine and as well as sports medicine. Welcome, Doctor.
Thank you for having me. And it's actually physical therapy.
Physical
Yes.
therapy. Sorry,
There's a difference. There's a difference.
that's
Yeah.
why, if you
Yeah.
remember in the first episode,
Yes.
I asked what is the difference between
Yes.
physical medicine and
Yeah.
physical therapy
Yeah.
because
Physical
some
therapy.
people get confused between that names.
Mhm.
So again, with the names, some people also get confused as we ended the first episode with the kind of
Chiropractic.
no,
Oh,
the first
that's
episode
so
when
no.
we
So
talked
yeah.
about the needles, and they
Yes.
think that there's a similarity between the Chinese needling and the dry
And the
needling.
dry needling.
So you get us now here,
Yeah.
and we need you to explain what is the difference between the different kind
Absolutely.
of needles.
Absolutely. Yes. My pleasure. So basically, if you think of the Chinese needles, these are more acupuncture.
Hmm.
Or the Chinese needles tend to go directly to the pressure points in your body.
Hmm.
So it's more than one needle throughout the whole body. I'm sure everybody's seen the photo of the guy with the needles in his face, and so they just leave the needle there, and they relieve the pressure by just leaving the needle.
Hmm.
With dry needling, we found out that no, you have to go to the root cause of the muscle
Hmm.
and directly needle that area, and so that area would actually twitch and give you a response, and that twitch is basically the muscle reacting to the needle and secreting the acidity that is the pain basically in the body and letting it out. So I'm a very firm believer of dry needling. As I told you, it's one of the best techniques that I can advise for somebody who's dealing with pain, especially muscle related pain.
Hmm.
So any migraine headaches due to neck spasms, low back pain due to muscle spasms, rhomboids due to the using the phone, dry needling is the way to go.
Now
Dry
you
needling
have
is
ruined my
honestly,
next question because it was about the indication of the use of the dry needling.
yeah.
You already have mentioned
Yeah, so
the
it is
indications.
muscle pain. It
Yeah.
is all muscle pain. It's related to most of the patients here actually because they go to the gym, they injure themselves during a certain exercise or during sleep or let's say a weird position,
Yeah.
if especially if they're office workers. And so as a as a physical therapist for dry needling, I'll have to just palpate the area first,
Hmm.
look for the tender points, and then just with the needle go directly in. You have to be very good at anatomy because you don't want to hurt
The nerves.
the nerves or the arteries around the area. And one of the most dangerous areas to needle is the rib cage,
Hmm.
especially in the back, because it hasn't happened yet to me, alhamdulillah, so far. But I've heard some cases, and it does happen that the needle tends to go inside the ribs and puncture the lungs,
Hmm.
and so you would get a pneumothorax.
Yeah.
And this is something we totally want to avoid, 100% want to avoid. So this is one of the complications that
Do,
can be associated with dry
can
needling.
we use the dry needling for any patient having a pain from like a muscle rupture or something? Or
Muscle
just
rupture, no.
does it have
Muscle
to be like a
spasm,
muscle pain
yes.
spasms or
Yes.
only that?
Yes. Muscle spasm, yes. Usually with muscle ruptures or muscle tear,
Hmm.
it's just diagnose it with an X-ray. If it's a full tear, they would have surgery. If it's a partial tear, you can actually dry needle the area around it just
Hmm.
so you don't get the pain associated with it, and then you would give that patient physical therapy.
Yeah.
But for dry needling, it's usually muscle related or musculoskeletal pain.
Okay, now the question is like people can see that that kind of technique of giving the needles or the dry needling is becoming very common now in
Very
the
popular.
society.
It's
If
very
they go to
popular.
anywhere, they might introduce them to dry needling. Now,
Honestly, it's becoming too popular. That's the problem because not everybody is a good dry needleist.
that's the question. Is
Yeah.
it's not only about the technique you
Yes.
use on insertion of the needles into the body. It's
Yeah.
about even the technique you would prepare the needles for the insertion.
Exactly.
Is there like any certain technique to use, like an aseptic technique or something?
I've gone to the guy who wrote the book on dry needling, and I've learned from him. And it's Dr. Ian Domerholt. He's German, living in the States, and he's the one who taught me that technique.
Hmm.
So you would have some clients coming in, and they said, Physio Yousef, I've done dry needling, and it doesn't work. And I'm like, okay, so tell me what they did, and they would explain a completely different technique,
Hmm.
completely different from the one I've done, and you can always tell a knockoff from the real thing. So when I would give them the needle or in the same area of pain, oh, whoa, this is
There's a
new. Oh,
difference.
no, no, there's a huge difference.
Yeah.
Oh, wow, okay, no. But usually these patients are the ones who call you back and tell you, we don't have pain anymore.
Yeah.
What did you do? I'm like, I didn't do anything. I was taught to do it this way. But now it's becoming too popular, and people don't want, because by the way, the dry needling studying took a long time also,
Yeah.
and the exam was very difficult. And so a lot of people now, they just want to bypass. They don't want to take the exam. They want to just do it online. I've heard people do it online. How can you
How
do
can you
dry
do
needling
that online?
online? You know, they do it online and then they say, oh, we're dry needleist now.
Mm.
For the clients, you have a right to ask, where did the person, the physio got his degree,
Yeah.
and if it's okay to show you the degree. Because let me explain something. Dry needling is in 3 stages: dry needling 1, 2, advanced, and then you have to do the exam. I didn't practice dry needling until I did the exam and got the license.
And you got all these stages.
You have to go
Yeah.
through stage 1, 2, and 3, and then the exam and the practical examination also. A lot of therapists, they do stage 1 and then they stop. And then they say, we are
They
dry
mentioned
needles now.
themselves as a dry needlist.
Unfortunately, there's some dark
Dark.
clouds in the
Everywhere. That's everywhere.
yeah,
Now the
unfortunately.
question is, you have mentioned very well the techniques used in the patient himself,
Yes.
but some people might ignore the cleanliness of the instruments.
Mhm.
They might also ignore the cleanliness of the place they are going to. So
Yes.
is it that important, especially when you are using needles
It
that
is
goes directly into the body?
very important because we don't want any bacterial infection or to develop any infection. Now, for the needles themselves, they already come in a
Packed.
secured
Yeah.
in a pack. You don't have to do anything besides inject the patient.
Mhm.
They already come sanitized and everything, and it's actually a one-time use. So you use it on the patient. You can use it on multiple sites on
Mhm.
the same
On the
patient,
same patients.
and then you
Yeah.
throw it away.
Yeah.
You know, and the area, of course, you have to disinfect the area. I have to wear gloves. I'm allergic to the latex gloves,
Mhm.
but I always tell my patients my hands are completely disinfected, but sometimes I wear plastic gloves. I've heard, my colleagues, Dr. Zaid, as we mentioned, he's the kind of person that actually takes care more of the sanitation more than anything.
Mhm.
So the sanitation is very, very important. And this goes back to, please don't go to a place like a certain apartment where
Look,
they do
like
it on the
sometimes they
floor.
look for cheaper.
Go to invest in your health.
Yeah.
That's the best investment you can do. So go to a proper clinic, go to a proper clinic that has good disinfection, a good nurse, a proper medical family or a team that can take care of you in case anything goes wrong. So this is one of the most important things that
as
our
well as
viewers have
as well
to
as
realize.
they must also focus on the license. It must be a licensed
Very
place
important. Thank you for
rather
saying
than
that.
going like anywhere that just come in
Very
place.
important.
And
Thank you for
the
saying that.
point is, like, if you go to a place, if you see the needles, as you said, unpacked,
Hmm.
that gives you an impression that that has been previously used on someone.
Exactly. Yes.
Don't tell me that it has been disinfected using alcohol or something, because
No.
it has to be packed by itself, opened in front of you, so
Yeah.
you can make sure that it's disinfected.
Exactly.
Now, is there like any certain age that we can use the dry needling with?
AIDS,
Age.
age.
Yeah.
It's anybody can
So
use dry needling.
can it be
Can
used
be
for
used from
children or
from
for
from
older?
10 years old and above. Yep.
Any contraindications?
Well, we try to avoid hitting any arteries, any nerves. If obviously open wounds, we don't do any dry needling.
Mm-hmm.
If there's certain area that has trauma, we
Mm-hmm.
don't do dry needling. But most of the time, it's actually allowed to do it.
Even if the patient like is having any chronic disease like diabetes or
It's fine,
hypertension or something,
completely fine,
is it fine?
completely fine. With diabetes, you have to be very sensitive because the patients have decreased sensitivity.
Yeah.
But as a therapist, you can touch the muscle, you can see if it opened up or not, and they usually tell you, my pain is associated here.
Mhm.
So most of the time, it's fine. It's unlike chiropractic, which there's some contraindications associated with it, but with dry needling, it's less contraindications.
Okay, the last question for our segment is like, let's make a difference between the dry needling and the Chinese needles again.
Mhm.
Sometimes we see the pictures of the Chinese needles experts, they use the needles everywhere in the body at
Exactly,
once. Can
exactly.
it be the same for the dry needles as well?
No, because with the acupuncture, the type of needle is different.
Mm-hmm.
With dry needling, it's
Mm-hmm.
very thin needle that goes directly to the pain sites. With the acupuncture, they tend to go more towards pressure.
Mm-hmm.
So if you have high pressure here, high pressure, they believe in trigger points and pressure. With dry needling, no, we go directly to the site of pain or to the root pain and try to get a muscle impulse.
Mm-hmm.
With acupuncture, no, they would just put the needle play with it a little bit just so the pressure gets relieved. But we look for a trigger point and we look for a muscle impulse
And
or muscle twitch.
with the Chinese needles, when we see the pictures, we normally see the patients look like a hedgehog because
Yeah,
of the
exactly.
number
There's
of
a lot of them.
a lot of
Yeah.
needles over the
Yeah,
body.
there's a lot.
Dr. Yousef, we are so pleased to have you again here.
Thank you for
And
having me.
hopefully we can have you again
It's been a pleasure. Thank you.
to discuss the updates in the physiotherapy.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of this segment. Hopefully we can see you again with another healthcare specialist. Until that time, goodbye.